Welcome to our second bite-sized video where we aim to provide you with a brief overview of Part 3 of the Health and Care Staff in Scotland Act 2019. This video will be focusing on arranging staff and the responsibility of providers which is applicable to childminders. The term staff is referred to whether you have an assistant or working as a sole childminder and you are your own staff member. The Safe Staffing Programme was commissioned by the Scottish Government to support care services to prepare for the new legislation, the Health and Care Staff in Scotland Act 2019. This is the first legislation in the UK to set out requirements for both health and care services. When enacted in April 2024, it will affect legislation that guides the requirements of your service you currently provide. The Act links together supporting documents and guidance already in use and has now been put into legislation. The current legislation that covers staffing is Regulation 15 of the Scottish Statutory Instruments. It is a small paragraph in the instruments which details how providers must have regards to the size and nature of their care service when arranging their staff and ensuring that there are suitably qualified persons working in the service. The asks of the current regulations are all still present in the new Act. They just go into more detail as there is a focus on the recognition that we all know and appreciate that high quality staff provide high quality service. The expectation is that when the Health and Care Staff in Scotland Act comes into place in April 2024, this regulation from the current instruments will be revoked.
Part 3 of the Act outlines the duty on care services to ensure appropriate staffing. You still need to fully consider how many staff you need to provide your service. The new legislation does not impose specific staffing levels, and this will not change at this time. Childminders will need to consider how they've arranged their staffing around the children's needs and not set ratios.
This slide demonstrates the similarities between the current Regulation 15 and the new legislation, with wording from Regulation 15 on the left-hand side of the table and wording from the new Act on the right-hand side. Part 3 of the Act outlines the duty on care services to ensure people with appropriate skills, competencies and values are working in the service. This, of course, is referring to ensuring your own professional knowledge is up to date by undertaking appropriate training or reading, or engaging with discussions with other childminders or childcare professionals, with a view to work towards continuous reflection and improvement. The minimum ratios provided by the Care Inspectorate will not be changing at this time for any service in ELC, including childminders. However, there is still the responsibility for you to determine what constitutes appropriate childcare provision, but considering the nature of your service, the number of children experiencing care, and the needs of those children. When referring to assistance, the similarities between the current Regulation 15 and the new Act are very similar. The wording is a little different, but in general, the ask of Part 3 of the new legislation does not differ much from Regulation 15, with the exception of the well-being of staff. More information can be found on the first bite-sized video which discussed Part 1 of the Act. A knowledge and skills framework has been developed by a healthcare staffing programme within the Healthcare Improvement Scotland and the NHS Education Scotland. The aim of this framework is to support all staff within the health and care sector, to provide a consistent and inclusive approach to learning and development to support individuals and organisations in their understanding of workload and workforce planning and the application and implications of this legislation. The framework is broken into 4 domains, and within each domain there are 4 skill levels. The modules for the first 2 levels, Informed and Skilled, are currently available on the tourist site, which is an NHS Education for Scotland learning and development platform. Although predominantly an NHS resource, everyone within the social care sector is able to set up a free account and access the training. The enhanced and expert levels are still being developed to ensure modules can offer an effective learning experience for all sectors. The further development is underway and the SSSC will keep the sector up to date with expectations of the use of this learning resource. Thank you for watching this bite-sized guidance on Part 3 of the Health and Care Staff in Scotland Act 2019. I hope that it was helpful to prepare you for the enactment in terms of becoming aware of this new legislation. Within the Hub, you can access additional support. There is another bite-sized guidance which talks you through Part 1 of the Act, and you can find guidance documents about the Act. Please join our mailing list to ensure that you are kept up to date with upcoming events and any other relevant information that may affect you in the sector.